Hi, I'm Phyllis Jones. Welcome back. And I'm joined right now by Donna P.
Yes.
And you are a registered nurse for
I
30
am.
years.
Yes.
You're with Holy Family.
Yes.
Well, thank you for joining us.
Thank you for having me.
Now, you're on specifically to talk to us about the Patient Safety Act.
Correct.
Can you tell me a little bit more about that?
Well, this is state legislation to have limits on the number of patients that nurses are responsible in acute care hospitals to take care of at one time.
Acute care.
Meaning in a hospital where patients are acutely ill.
I can tell you from my own personal experience, 2017, yeah, so it would have been last year, still at this point, my son was in the hospital at Tufts. So we relied heavily on our nurses.
Yes.
And my aunt is actually a registered nurse. She's retired now, but she's now also a registered nurse. So I know how important it is for nurses to have the right amount of patients.
Absolutely. Absolutely. Because we all just want to do a good job and take good care of our patients.
Exactly. Now, Patient Safety Act, state legislation.
It is state legislation.
How long has it been on the floor?
Not sure. It's a ballot issue. And I know that it's been in California. They've passed this law since 2004, and it's working very well for the nurses there and mostly for their patients.
Okay, so it's a ballot question. Mm-hmm. Is it coming up in September or November?
November.
Okay, so we've got plenty of time to learn a little bit more about it.
Yes.
And is there a website that you can direct us to? Or
safepatientlimits.org.
I know I'm putting you on the spot with a lot of these questions.
That's okay.
But you're educating me in the process. So, if you're educating me, you got to be educating them too.
Well, that's great.
How'd you get involved with doing this on a more personal level?
Well, like I said, I'm a registered nurse in a local hospital, and I belong to the Mass Nurse Association, and I know they have been strongly promoting this, and I think it's important for people to hear the opinion of nurses that actually work with the patients at the bedside in the hospitals.
Okay, well, obviously you folks are getting more and more patients assigned to you, which is why you're initiating this ballot question. Right. How have things changed in the past 30 years that it's at this point that you are initiating this? Is it just that,
I think one of the biggest changes is that the people that are in the hospital are sicker.
Okay.
And, so a nurse taking care of this many patients, if they're very sick, is difficult. And, to be doing all the patient care and giving all the medications, you really can only have a certain number of patients, especially if they're more acutely ill.
On average, without this question going through, on average, how many patients do you take care of on your shift?
Well, I work in a different department. I work in a department where we do procedures, so it's a little different. On the floors, I would say they have 6 to 10 patients the nurses are trying to take care of every day. And depending, if they had one patient that had a problem, or say chest pain, and they have to be directly with that one patient, so all these other patients that are being looked after. So.
And if this ballot initiative passes, what would that bring the limits of patients down to per nurse?
So it depends on how sick the patients are.
Okay.
And then the nurses can, I guess, decide if they can take on more patients that aren't as sick, and be able to do that in a safe way to make sure that they're giving all their patients the care that they need.
And I understand you're not working on the floor anymore, but I'm sure at some point you did.
Yes, I did.
How are different assignments handed out to the patients, or to the nurses regarding the patients, excuse me?
Well, you come in the morning and they're given an assignment of 8 or so patients, and there's so many nurses and so many aides on the floor, and it's kind of just split up.
But it's not based upon, like, you have an expertise on, just to use something simple.
Not usually, no.
No, it's just, this is your assignment.
This is yours. You get room 1 through 8, and so those are your patients for the day.
And you don't necessarily also have the same assignment for the same patient. If you have somebody like my son who had an extended stay at the hospital.
Right.
You know, a lot of times, well, pediatrics, they tend to work
Do a
things
little differently.
differently.
Yeah.
But you don't have, like with pediatrics, you don't have, if I'm your patient today, I might not necessarily be your patient tomorrow.
That's true.
So you don't have that bonding ability.
Right. I mean, sometimes you do, but not always. And staff changes every day too. So.
Right. Right. But with something like this, by lowering the patient amounts that each nurse could handle, might that give the hospital more of an opportunity to do some more of that bonding opportunity?
So. Sure. I would hope so. Well, all nurses want is to really take good care of their patients, and that's what gets most nurses frustrated, is that if they go in and their assignment's too big, and they're frustrated. I talk to them all the time, and all nurses just want to take good care of their patients. So the bedside nurses just want to have the time that they need to be able to do that. Because that's what they want, is to give good patient care.
Well, and that's the whole reason why you got involved in nursing to begin
Absolutely.
with.
Absolutely.
If you didn't want good patient care, you'd be somewhere else.
That's right. It's a great profession, but you got to be able to. The good nurses get frustrated. A lot of them leave because they can't do a good job, and they don't like. Nobody likes that. Nobody wants to go to work and feel like they're not giving each patient what they deserve.
Totally understandable. Well, thank you for sharing this. I'm sure people will be checking out that website and taking a look, because I know that a lot of people who've had to go to the hospital, a lot of things that they get frustrated about is that the nurses aren't necessarily there.
That's right. They put their light on and no one answers it.
Exactly. So. And like I said, I realized my son was in the pediatric wing, but there were a couple of times where, unfortunately, I had to scream out for somebody to come in because. So thank you for doing what you do.
Well,
thank you for coming on, Donna.
Thank
I appreciate
you for having me. Thank you for having me on this hot day.